This is the second half of the IV therapy and IV bolus medications combined station. This portion of the station will assess the candidate's ability to administer a bolus of a medication given a patient scenario. There are no additional rescuers required for this skill. Candidates have only 3 minutes to successfully administer the IV bolus medication.
Provided that you are successful initiating the IV line, you now must select and administer the appropriate IV bolus medication based on a brief patient scenario you will be provided. There must be absolutely no doubt in your mind as to the correct medication and its dose. Once you give the drug, you cannot take it back.
Candidates at this station will have equipment and supplies necessary to select and administer an IV bolus medication. These items include an IV arm mannequin with the IV already established, Sharps container, IV medications, either in pre-filled syringes or vials, and medical exam gloves as part of the necessary personal protective equipment. There are 2 main sections of the IV bolus medication station: medication selection and preparation, and medication administration.
This is the second part of the IV and medication administration skill station. It is designed to test your ability to properly select and administer IV bolus medication. You've had the opportunity to check your equipment. Do you have any questions?
No.
Okay. Your 54-year-old patient is hypotensive, and the cardiac monitor shows sinus bradycardia at a rate of 45.
Okay. Does the patient have any allergies to medicine?
The patient has no allergies.
Okay. For this patient, I would choose atropine. I'd make sure that it's in date. There's 1 milligram and 10 mLs of fluid. For this patient, I would give half of that, which is 5 mLs of fluid, and 0.5 milligrams. I would continue using BSI precautions. Atropine, 0.5 milligrams. I've administered 0.5 milligrams. I would flush the line, turn it back to KVO, and I would watch for the desired effects.
Is there anything else that you would like to do for this station?
No.
Thank you. This concludes the IV and medication administration skill station.
Begin the station by confirming that BSI precautions are being continued from the previous IV therapy station. Determine if the patient has any medication allergies. Based on the patient scenario, select the correct medication and verify its concentration and the desired dose to administer. Assemble the delivery device. Clean the injection site. Reaffirm the medication and its dose. Stop the IV flow by pinching the tubing or shutting down the line. Administer the correct medication dose at the proper rate. Dispose of the syringe and needle in a Sharps container. Flush the tubing for a brief period. Readjust the IV drip rate. Observe the patient for the desired or adverse side effects. With the scenario complete, the examiner checks the candidate's performance against the critical criteria for the station. The critical criteria for this station that would have resulted in failure were failing to begin administration of the medication within a 3-minute time period, contaminating equipment or site without correcting the mistake, failing to dispel air resulting in the potential for an air embolism, injects an improper medication or dosage, failing to flush the tubing after injecting the medication, failing to dispose of the needle appropriately.
Among the more common IV bolus medications found at the station are those that you would also more commonly administer in the field, such as epinephrine, dextrose, atropine, and adenosine. Among the more common mistakes encountered in the station are the failure to pinch the tubing prior to administering the medication, failing to flush the tubing afterward, and failing to convert milligrams to milliliters before administering the medication.